Do I have consent to do a postpartum assessment on you, Julia?
Mm-hmm.
Okay. Um, so this is a postpartum assessment. Let's see, we provide patient safety and privacy by shutting the door. We wash our hands. Introduce myself. I'm Kristen. I'm going to be a nursing student to do your postpartum assessment. Your birth history. We're going to say you're a 23-year-old female who had a spontaneous rupture of membranes who delivered a baby boy at 11:02 a.m. He was 7 pounds 9 ounces. Let's see. We're going to check your vitals. We're going to check your heart rate, your respirations, blood pressure, and your temperature. And then we're going to go to our postpartum assessment. We're going to start with your breasts. Depending on if you're bottle feeding, we won't mess with your breasts. We encourage you to wear a tight fitting bra. That way the milk doesn't come in. If you want to breastfeed, then we suggest that to not wear a tight fitting bra. That way the milk can come in. We just need to check to make sure there's no cracks, no swelling, or anything wrong with your breasts that would prevent you from being able to breastfeed properly. Next, we're going to check your uterus. I'm just going to check your belly. Try to find your belly button. And then we're going to put your non-dominant hands on the pubic bone and then below the umbilicus, and you're just going to push on her uterus to make sure that it's firm and it's not boggy. If it is boggy, you may want to ask when was the last time she used the bathroom, which is another one of the B's. To make sure her bladder is empty and make sure that uterus stays firm. The other B is bowel. So we would ask, when was your last bowel movement? We could encourage water and fiber to help get those bowel movements going. We could also provide a stool softener to help the bowel movement come out easier. Next L is the lochia. So we would check mom's pad to see how much blood, and make sure it's not too much, because we don't want her soaking through pads within 15 minutes or less. And there's 3 types of lochia: the lochia rubra, serosa, and alba. Let's see, E is for episiotomy. So if she has an episiotomy or a laceration, we want to check that. We want to make sure, we want to check the redness, edema, ecchymosis, the drainage, and then the approximation, which would be the stitches. But that would also go for C-section. So, check mom's C-section stitches and make sure that everything looks good as well. That's what E. Then we also have Homan signs. So we would check her legs and her lower legs and see if she could push her feet and make sure she's not having any pain or no swelling in a leg. The next E is for emotion. So we want to make sure mom is doing okay. She's not depressed. She's not having baby blues, that she's bonding with the baby, she's feeding and spending time with the baby, and she's just not ignoring the baby and playing on her phone or not taking care of the baby. We want her to take care of the baby and bond with that baby. R is for RhoGAM, which is if mom's blood is negative and baby's blood is positive, then mom has to get a RhoGAM shot. after the baby's born. And yep, that concludes our postpartum assessment.